The emergency room director grabbed Emily Carter by the arm and physically shoved her away from the operating room doors. "Stay in triage," Dr. Ethan Brooks snapped, loud enough for half the floor to hear. "You're just a nurse." She stumbled back 2 steps. Her bad knee buckled slightly. A passing orderly looked away. 40 seconds later, the roof of Pine Ridge Regional Hospital exploded with noise. 4 military helicopters descending in tight formation, their rotors shaking the windows, scattering paper cups from the nurses' station, cutting every conversation in the building dead. Every overhead speaker crackled at once. "This is U.S. Military Command. We need Angel 6. Immediately. Repeat. Angel 6 to the roof. Now." The entire ER went silent. Every head turned. They all turned toward Emily Carter. If this story already has you hooked, follow along until the very end, hit like, and drop a comment telling me what city you're watching from. I want to see exactly how far this story travels. Let's go. The morning had started the way most of Emily Carter's mornings started at Pine Ridge Regional, with someone underestimating her before she'd finished her first cup of bad cafeteria coffee. She was 28, 5'4", with a slight hitch in her left leg that had been there so long she barely noticed it anymore. Most people noticed it for her. They noticed the limp, the quiet demeanor, the way she didn't push back when attendings talked over her, the fact that she'd shown up to work at a small regional hospital in Silver Falls, Montana, rather than some level 1 trauma center in Chicago or Houston. They built a whole story around those details. The story they built was mediocre. She'd let them keep it. Silver Falls was a town of 40,000 people sitting in a valley between mountain ranges that turned purple at dusk and white by November. Pine Ridge Regional was the only hospital within 60 miles. It had a 20-bed ER, 2 surgical suites, a labor and delivery ward, and a staff-to-patient ratio that made most shifts feel like controlled chaos held together with electrical tape and willpower. Emily had been there 11 months. She knew where the crash carts were. She knew which IV pumps had faulty alarms. She knew that Dr. Ethan Brooks, chief of emergency medicine, had a habit of arriving 20 minutes late and spending those 20 minutes making sure everyone knew he'd arrived. She did not particularly like Dr. Brooks. This was not a secret she shared with anyone. She just worked her shifts, did her charting, ran her triage assessments with a quietness that some people mistook for passivity, and went home to her apartment above a hardware store on Callaway Street where she kept 3 plants alive with suspicious consistency and slept better than most combat veterans had any right to. It was a Tuesday in late October when everything that had been quiet stopped being quiet. The first call came in at 6:42 a.m., just before shift change. A school bus had gone off a mountain road 12 miles east of town. Ice on the curve, driver overcorrected, guardrail gave way. 17 kids, the driver, and a parent chaperone. EMS was already rolling. Pine Ridge was putting out an all hands. Emily was already in scrubs. She tied her hair back, checked her pockets, penlight, tourniquet, shears, and walked out to the ambulance bay. Brooks was there. He'd come in early for once, which meant someone had called him, which meant administration was already managing optics. Carter. He didn't look at her. Triage Bay 3. You're doing vitals intake and secondary assessment only. I need my trauma team on the floor cases. She looked at him. I can run a trauma bay. You're a floor nurse. I'm a trauma-certified floor nurse. He finally looked at her. He was a tall man, broad-shouldered, with the particular brand of exhaustion that came from being important rather than from working hard. His expression was not unkind exactly. It was something flatter than that. The look of someone who had already categorized her and had no intention of revising that category. Triage Bay 3, he said again, and walked away. She went to Triage Bay 3. The next 4 hours were the organized disaster that mass casualty events always were at under-resourced hospitals. Ambulances cycled through. Kids came in crying, unconscious, and everything in between. Emily worked her bay with methodical speed. A fractured clavicle here, a possible spinal here, a kid with a head lack who wouldn't stop screaming, and whose screaming, Emily noted, was actually reassuring because it meant his airway was fine and his brain was still fighting. She charted, she delegated, she flagged 3 cases for immediate surgical consult that 2 other nurses had initially classified lower. 2 of those 3 went straight to the OR. Both survived. Nobody told her she'd been right about them. Nobody tracked it back to her call. That was fine. That was how it usually worked. By 11 o'clock, the acute wave had settled into the sustained chaos of a hospital, absorbing more patients than it was designed for. Emily was charting at a workstation when she heard Brooks on the phone outside the nursing station, his voice lowered but not low enough. Doesn't need to be on trauma cases. She doesn't have the experience. She stopped typing for 1 second, then kept typing. A voice she didn't recognize said something she couldn't make out. Brooks again. I don't care what her file says, Garrison. I've watched her work for almost a year. She's not trauma material. Emily saved her chart and moved to her next patient. What Brooks didn't know, what almost nobody at Pine Ridge knew, was that the file Garrison was apparently referencing contained 4 overseas deployments, 2 with the 75th Ranger Regiment, and 2 embedded with a Joint Special Operations Task Force operating in environments that Brooks, for all his seniority, would not have lasted 48 hours in. It contained a combat action badge, 2 Army Commendation Medals with Valor devices, and a call sign, Angel 6, that had been assigned to her by a flight surgeon named Colonel Marta Vega after Emily had kept 3 Rangers alive during a medevac that lost its primary nurse to an IED strike 3 miles outside the exfil zone. It also contained a medical discharge, the result of a below-the-knee nerve injury that had been repaired twice and left her with a limp that doctors said was permanent and that Emily had decided was manageable. She had left the military at 26. She had spent 8 months in a VA rehab program that she never talked about, then taken her nursing license and her resume, the civilian version, which mentioned none of the above, and driven to Silver Falls because a friend of a friend had mentioned the hospital was hiring, and because she needed somewhere quiet, and because she had not yet figured out who she was when nobody was shooting at her. 11 months later, she was still figuring it out. She went back to work. The second call came at 2:17 p.m. Emily was in Bay 3 again, helping a 73-year-old man named Harold who'd come in with chest pain that turned out to be a panic attack triggered by watching his neighbor's tree fall on his truck. He was embarrassed about it. Emily was spending a few extra minutes with him because embarrassed patients who felt rushed sometimes left before their discharge paperwork was complete and sometimes came back by ambulance 2 days later. You're very calm, Harold said. Occupational habit, she said. Were you always like that? She considered it. No. She had just handed him his discharge instructions when the intercom system made a sound it was not supposed to make. A sharp 2-tone alert that she recognized from a different context, one that had no business being heard inside a Montana hospital. It was a military channel tone. She'd heard it on base. She'd heard it on aircraft. She'd heard it crackling through headsets at altitude in the dark. She had never heard it here. The voice that followed was male, authoritative, and clearly reading from a prepared statement in a way that indicated someone very senior had handed someone very junior a very urgent piece of paper. Attention Pine Ridge Regional Hospital. This is U.S. Military Command, Joint Operations Medical Support, Fort Harlow Coordination. We are requesting immediate assistance under Emergency Military Medical Protocol. We need Angel 6 immediately. Repeat, Angel 6 to the roof, now. Harold looked at the speaker on the wall. What in the world is that? Emily was already standing. The helicopters hit the roof before she'd crossed the nursing station. She felt them more than heard them at first. A low-frequency vibration that moved through the floor and up through the soles of her shoes and rattled the overhead lights. Then the noise came down through the ceiling, rotors and engines, not one but multiple aircraft, which meant not a training exercise, not a single transport, something with scope and resources and urgency behind it. The nurses at the station were frozen. An attending was standing in a hallway holding a tablet and staring at the ceiling. Brooks came out of his office with his jacket half on and the expression of a man who had no category for what was happening to him. What is... he started. The roof access door at the end of the east corridor burst open and 3 men came through it at speed. Military bearing, civilian clothes, ID badges on lanyards, federal contractor credentials. Emily clocked in half a second. The man in front was in his 50s, heavy set, with the kind of posture that said he hadn't always been behind a desk. He was looking at a photograph on his phone. He stopped when he saw Emily. Carter? Yes. Corporal Carter, call sign Angel 6. It wasn't a question, but she answered it anyway. That's correct. Brooks stepped forward. I'm Dr. Ethan Brooks, Chief of Emergency Medicine. What exactly is... Sir, with respect, I need to speak with your nurse. The man looked at Emily. I'm Deputy Director Alec Garrison, JOMS. We have a situation. Emily looked at the man carefully. Garrison. The name from the phone call this morning. She filed that away. What kind of situation? She said. A C-130 transport out of Malmstrom encountered severe structural failure in the storm system coming over the divide. She's still airborne, barely. 8 Marines aboard and 1 additional passenger, a civilian VIP. They cannot land at Malmstrom. The runway is compromised from ice. The closest viable emergency landing site is the plateau 14 miles north. We have a flight surgeon on one of the birds, but he's not flight trauma. He's never worked a multi-casualty moving environment. How long until they attempt landing? 90 minutes, maybe less, depending on the aircraft's remaining control capacity. Casualty count? 3 confirmed critical, 2 serious, 3 walking wounded. We have a preliminary injury report. He held out a tablet. She took it, scanned it. Penetrating chest trauma, likely tension pneumothorax. Bilateral leg fractures, hemorrhagic shock. Traumatic brain injury with GCS of 9. She handed the tablet back. What's my platform? Blackhawk. Modified medevac configuration. Limited supply load. We're pulling from what was on base, not a full trauma kit. I'll need you to radio ahead for specific items. I'll give you a list in 2 minutes. She turned toward the supply corridor. Brooks moved to intercept her. Carter. His voice had a quality in it she hadn't heard before. Not anger, something closer to alarm. What is happening right now? She looked at him. She was not unkind about it. She simply did not have time. There are 8 Marines on a crippled aircraft, she said, and I'm the one they called for. You're a floor nurse. You do not have the authority to... She has the authority, Garrison said behind her, flatly. Under what? Under emergency military medical support protocol, she's been activated under a standing order of recall. She doesn't need the hospital's permission. She needs her equipment. Brooks opened his mouth, closed it. Emily was already moving. She spent the 2 minutes she'd told Garrison she needed pulling a supply list from the inventory system on her phone. Not from memory of the hospital's stock, but from an ingrained mental architecture that came from years of working with whatever you had and making it enough. She texted the list to the number Garrison gave her and kept walking. In the locker room, she pulled her civilian jacket off and took her trauma vest off the top shelf. She'd kept it there since month 2, the week she'd treated a gunshot wound in the parking lot, and realized she'd never fully stopped being the person who kept a trauma vest in arm's reach. She checked the pockets. Tourniquet, chest seal, decompression needle, SAM splint, trauma shears, airways. She put it on over her scrubs. Her hands were steady. They had always been steady under pressure. It was one of the things she had never fully understood about herself, that the part of her brain that produced calm seemed to be directly wired to the part of her body that recognized danger. She walked back out through the nursing station. A young nurse named Priya, who had been with Pine Ridge for 4 months and who Emily had quietly mentored through 2 difficult nights, was standing near the elevator looking pale. Are you going up there? Priya asked. Yes. Are they going to be okay? The soldiers? That's the job, Emily said. It was not reassurance, and Priya probably knew that, but she also nodded in a way that indicated she understood what it actually meant, that the job was the point, that the intention to do it completely was the most honest thing Emily could offer. The roof access door was propped open. Emily climbed the stairs. The wind hit her at the top. October mountain wind, brutal and cold, the kind that makes you understand in your bones why people in Montana didn't argue with weather. 4 helicopters were on the roof in various configurations. 2 Blackhawks and 2 smaller birds she couldn't identify from here. Men in flight suits were moving equipment. A man in a surgical vest was consulting with 2 others near the lead Blackhawk. Garrison was waiting at the door. Beside him was a Marine. Not contractor clothes, actual service, BDS, Brigadier General stars on the collar. Late 50s, face like a held fist. Corporal Carter, the general said. Brigadier General Roy Decker, 2nd Marine Logistics Group. I'm going to skip the formalities because we don't have time for them. You were Angel 6 with Task Force Verona in 19 and 21. Yes, sir. Then you know what a flying trauma ward looks like. Yes, sir. Because that's what that aircraft is right now. He looked at her hard. You haven't worked flight trauma in 2 years. She met his eyes. I've worked it for 6 years. 2 years is a gap. It's not an erasure. He studied her for a moment that stretched about 2 seconds longer than was comfortable. Then he nodded, once, the way men like him nodded when they'd made a decision they were going to commit to. Our flight surgeon, Captain Rains, has the surgical skill. He doesn't have the triage experience for this configuration. You do. You'll work joint authority, so medical decisions in your lane, surgical in his. Can you function in that structure? I've done it before. Good. He turned toward the helicopter. We leave in 4 minutes. There's one more thing. She waited. The VIP. He said it carefully, the way military men said things they were required to say but wished they didn't have to. It's Senator Dale Whitmore, Armed Services Committee. He was aboard as an observer for a training flight. He's one of the serious casualties. We're calling it blunt thoracic trauma, possible rib fractures, hemothorax. Understood. His life is not more important than those Marines. I know. I need to hear you say that you'll prioritize by medical need, not by general. She kept her voice level. I triage by physiology. That's always been true. He held her gaze for another beat. Get on the aircraft. She walked toward the Black Hawk. The wind was trying to push her sideways. Her knee ached in the cold the way it always did. A dull familiar pressure she'd long since incorporated into her movement, the way a sailor incorporates the tilt of a deck. She was stepping into the crew bay when someone called her name. Not her rank, not her call sign, just her name. In a voice she recognized the way you recognize a sound that was burned into your nervous system at altitude somewhere over a country whose name she wasn't supposed to say. She turned, standing at the edge of the rooftop, in civilian clothes with a bandage on his left hand and a very specific look on his face, the look of a person who is trying to appear less surprised than he is, was Sergeant First Class Logan Pierce. Or he had been a sergeant. She didn't know what he was now. He looked older. He looked like 2 years had happened to him, the way 2 years in certain circumstances could happen to a person in a way that ordinary time didn't. Logan. She said it straight, no inflection. I'm on the manifest, he said. I was on the C-130. I walked off with the walking wounded. They didn't want to leave me behind when they came to get you. He paused. I told them I knew you. Do you? I thought I did. He looked at her. At the vest, at the roof, at the helicopters, at all of it. I didn't know you were here. I didn't know you were... He stopped. I thought you were out. I am out. He looked at the vest again. Mostly, she said. General Decker's voice came from behind her. Carter, clock. She looked at Logan one more second. How bad are the 3 critical? He'd been a battlefield medic. He knew what she was asking. His expression shifted from whatever it had been carrying into the focused, specific quality of someone giving a report. Sergeant Okafor has the chest wound. Entry, no exit. His breathing has been getting worse for the last 20 minutes. Private Reyes has the leg fractures. She's been tourniquet controlled, but she's shocky, and I couldn't get a good line in the turbulence. Staff Sergeant Muldoon is the TBI. He went down hard when the airframe shuddered. He was responsive, but deteriorating when I left. GCS 9? It was 11 when I left, 20 minutes ago. She absorbed that. A 2-point drop in 20 minutes was a trend she did not like. Are you stable? She asked. He held up the bandaged hand. Laceration. I'm functional. Can you assist? He blinked. On the aircraft? You have the training. I may need hands I trust. She said it without sentiment. It was a logistical fact. Logan looked out at the Black Hawk, then back at her. Something moved through his expression that she didn't have time to interpret. Yeah, he said. I can assist. Then get on the aircraft. She turned and climbed in. The crew chief secured the bay behind them. The rotors changed pitch. On the floor below, somewhere past the ceiling she could no longer see, Dr. Ethan Brooks was still standing in the nursing station, and Emily Carter was rising off the roof of Pine Ridge Regional Hospital in a military helicopter, heading toward a crippled aircraft full of wounded men and one injured senator, with 90 minutes to work with and a battlefield medic at her shoulder who she hadn't seen in 2 years and 17,000 things she was not going to let herself think about until the job was done. The skids left the roof. Silver Falls disappeared beneath them. The storm was already visible to the north, a dark mass dragging itself along the mountain ridgeline, moving south at a pace that made the math uncomfortable. Captain Rains, the flight surgeon, turned from the front of the bay and handed her the updated vitals report from the aircraft. He was younger than she'd expected, maybe 32, with quick eyes and the manner of someone who was competent and aware that competence had limits. Okafor's O2 sat just dropped to 88, he said. They're transmitting live now. She read the numbers, looked up. Logan was watching her from across the narrow bay, holding a grab strap as the Black Hawk banked north into the weather. His expression was unreadable in the way that people's expressions became unreadable when they were carrying something they hadn't said. She looked back at the vitals, 88%, dropping. She pulled her decompression needle from her vest and held it in her right hand, letting her thumb find the cap the way her thumb always found it. Automatic, practiced, emotion so deep in her muscle memory it happened before thought. The aircraft hit the first real turbulence of the approach. The lights in the bay flickered, and somewhere 12 miles ahead of them, through the coming storm, a C-130 with 8 Marines and 1 Senator was still in the air, for now. The turbulence hit them at 4,000 feet, and it was not the polite turbulence of commercial aviation that rattled drink carts and made first-time flyers grip their armrests. It was mountain turbulence, abrupt, structural, the kind that felt less like weather and more like the aircraft being grabbed by something with hands. Emily's shoulder slammed into the bulkhead. She absorbed it, adjusted her grip on the decompression needle, and looked across the bay at Rains. How long? 11 minutes to visual on the aircraft. He had a headset on and was watching the feed from the forward camera. They're maintaining altitude, but barely. Pilot says the starboard elevator is only giving 40% response. What's their airspeed? Down to 140 and dropping. She did the math. A C-130 stalling at low altitude in a mountain storm was not a scenario with many good endings. 11 minutes gave her exactly enough time to prepare and no time to improvise. Rains. She waited until he looked at her. When we board, I need you on Okafor immediately. Tension pneumo, left side, based on the breath sound report. You'll need to get a chest tube in before we attempt any movement. Agreed. I'll take Reyes for hemorrhage control and then get to Muldoon. Logan, she glanced at Pierce, who was already pulling on a pair of gloves from the supply bag without being told. You're with me on Reyes until she's stable, then I need you monitoring Muldoon's neuro every 3 minutes. GCS, pupil response, verbal. Logan nodded once. No questions. That was one of the things about working with people who had been in the field. They didn't ask you to explain urgency. They already understood it. What about the senator? Rains asked. Last. He looked at her. Blunt thoracic with possible hemothorax is not immediately life-threatening if his pressure is holding. Okafor's O2 sat at 88 with a penetrating chest wound is immediately life-threatening. We triage by physiology. She said it the same way she'd said it to General Decker on the roof. Not as a statement requiring debate, just as a fact requiring acknowledgement. Rains gave a short nod. He got it. The Black Hawk lurched hard to the left. A loose supply bag swung on its hook and Logan caught it with his good hand before it took out the radio unit on the starboard wall. He secured it without comment and went back to checking his supplies with the focused efficiency of someone who had kept his hands busy through worse things than this. Emily looked at him for a moment, at the set of his shoulders, at the deliberate steadiness of his movements, and recognized it for what it was. He was doing the same thing she was doing, keeping the machinery of the body occupied so the rest of it didn't have space to pull toward whatever it was the two of them hadn't said yet. That was fine. There were wounded people ahead of them. The rest could stay where it was. The crew chief's voice came through the intercom. 3 minutes. Target aircraft is visual at 2 o'clock. Emily put the decompression needle back in its designated pocket, checked her chest seals, checked the tourniquet on her left forearm strap, and looked out the porthole. The C-130 was there, a gray shape against a darker gray sky, massive and wrong-looking. The right wing was sitting slightly low. Even from this distance, she could see the irregularity in the fuselage, a darkening along the rear cargo section that she didn't like the look of. The aircraft was flying, but it was flying the way a person walks when something is broken, compensating, laboring, burning reserves. God, Raines said quietly, looking out his own porthole. Emily didn't say anything. She zipped her vest closed and wrapped her right hand around the bay door handle. The transfer from the Black Hawk to the C-130 was done via a stabilized hover and board sequence that she had practiced 4 times in her life and performed twice under actual conditions, and it was exactly as controlled terrifying as it always was. The 2 aircraft flew in parallel formation with 20 feet between them, and the door crew on the C-130 extended a transfer ramp that was technically rated for this maneuver, and practically was the kind of thing you did not think too hard about while you were doing it. She went across first. That was not the plan. The plan had been for Raines to lead, but when the ramp extended and the C-130's rear cargo doors yawned open and she could see inside, she went first because what she saw required the person with triage experience to make the call. The cabin was chaos. Not panic. The Marines in there were too trained for panic, but it was the particular organized chaos of people who had been managing a bad situation for too long with inadequate tools. The cargo hold had been converted into a crude casualty area, with wounded personnel laid against the fuselage walls, and one Marine who was clearly the ranking medic moving between them with the tight expression of a man who was 2 decisions away from being out of options. The smell hit her as she cleared the ramp. Blood, sweat, the acrid sweet smell of a fuel line that was somewhere it shouldn't be. She filed the fuel smell immediately and said to the medic who reached her first, "Where's your pilot?" "Cockpit. We're not touching him." "Not asking about the pilot. Is there active fuel vapor in this cabin?" The medic, a corporal, maybe 23, with a tourniquet on his upper right arm that someone had applied correctly, looked at her with the expression of someone realizing he'd missed something. I don't know." "Find out. Radio the cockpit. If there's vapor, we cannot use the defibrillator." She was already moving as she said it, moving toward the man she'd identified as Okafor, based on the position data, and the very obvious visual cue of a man lying on his back with labored asymmetrical chest movement. Sergeant Okafor was a large man, probably 220, with the kind of muscle mass that complicated a chest tube because the external landmarks were harder to find. He was awake, which was something, but his eyes were tight with pain, and his breathing was doing the thing that breathing did with tension, pneumo. Short, increasingly shallow, working harder to accomplish less. "Sergeant Okafor," she said, crouching beside him. "I'm Emily Carter. I'm a trauma nurse. Tell me where it hurts." "Left side." His voice was strained. "Feels like something's pressing." "That's exactly what it is. I'm going to fix it." She put her fingers on his left chest wall and found the second intercostal space, mid-clavicular line, the way she'd found it a dozen times in conditions considerably worse than this. "Raines?" She didn't look up. "You're here." Raines had boarded behind her and was already kneeling on Okafor's other side. She talked him through the landmarks as she prepped the site, not because he didn't know them, but because in this environment, in this turbulence, with this patient, a second set of orientations was not redundancy. It was safety. The aircraft shuddered. Her elbow hit the floor and she steadied herself and kept the needle in position and said calmly, "Hold." Raines held. The shudder passed. "Go," she said. The needle went in. The hiss of released pressure was immediate and Okafor's body responded to it the way bodies responded to decompression. A visible, physical relaxation, like a fist unclenching. His next breath was better than his last. His color started to come back from the grayish quality it had been holding. "Chest tube next," she said to Raines. "He needs the drain. I'm going to Reyes." She stood and turned and scanned the cabin in the 3 seconds she had before the next problem presented itself. Logan had already found Private Reyes on his own. He was at the far end of the casualty area, crouched over a young woman whose legs were splinted in a way that indicated someone had done good field work, but the tourniquet on the left leg was at the edge of its effective window. Emily crossed to them, her knee complaining on the uneven cargo deck, and crouched opposite Logan. Reyes was young, 19, 20, the kind of young that made you briefly aware of how wrong a place like this was for someone that young, and then you set that awareness aside because awareness of that particular fact was not useful right now. "Private Reyes," Emily said. "Ma'am," her voice was thin, "I'm going to get a line in and get some fluid into you. Your legs are going to be fine." She said the last part with sufficient conviction that it was likely to be true. She didn't promise things she wasn't prepared to deliver, but Reyes's leg fractures, though serious, were mechanical. The hemorrhage was controlled, the perfusion distal to the tourniquet was still present, which meant the vascular anatomy was intact. The shock was volume shock, addressable. Logan held the arm. Emily found the AC vein, got the catheter in on the first attempt despite the turbulence, and taped it down. "Large bore second line," she said to Logan, who was already reaching for the second catheter. "Got it. Warm fluids if we have them." "We've got lactated ringers, not warmed. Run it anyway. Her core temp okay?" Logan pressed 2 fingers to the inside of Reyes's wrist. "She's cool but not dangerous. Keep her covered." She passed him the thermal blanket from her vest and was already moving before it left her hand. Muldoon was behind her. Staff Sergeant Muldoon was 41 years old and built like someone who had spent those 41 years doing physical things in difficult places. He was lying on his left side with a Marine beside him, who had clearly been tasked with watching him and who looked deeply relieved that a medical professional had arrived. The TBI was visible, a forehead laceration with bruising that suggested significant impact, right pupil slightly larger than left. And when Emily ran her pen light across both pupils, the right one was sluggish. 2-point GCS drop since Logan had left the aircraft. Now she was looking at it herself. "Muldoon," she said loudly. "Staff Sergeant, open your eyes." He opened them, slow, effortful. "What's your name?" "Muldoon." Slurred slightly. "What day is it?" Long pause. "Tuesday." He was right. That was something. She'd been worried she'd get silence or nonsense. "Good. I need you to stay with me. Can you do that?" "Yeah." Then, unprompted, "My head really hurts." "I know." She put her hand briefly on his shoulder. Not a clinical gesture, just a human one, the kind that cost nothing and sometimes mattered, and then turned to the Marine beside him. "Do not let him sleep. Every 2 minutes you talk to him. Ask him his name. Ask him where he's from. Ask him what he had for breakfast. If he stops answering or if his breathing changes, you shout for me immediately." "Yes, ma'am." She stood and took her first full breath since she'd boarded the aircraft. The cabin was still loud. Engines, wind, the structural groans of an airframe under stress. But the acute picture was clearer now. Okafor was being managed, Reyes was being stabilized, Muldoon was being monitored. The other 5 casualties were wounded in ways that were serious but not immediately fatal. She'd cross-checked their status against the report she'd read on the helicopter, and nothing had significantly deteriorated. The 2 serious cases were an ankle fracture with vascular compromise that needed surgery but could wait, and a blast concussion with persistent nausea that needed monitoring. Walking wounded were walking. She turned to find Senator Whitmore. He was not where she'd expected him to be. Based on the manifest, he should have been in the forward section, but a Marine lieutenant she flagged down told her the senator had insisted on sitting with the casualties rather than being isolated forward, which was either admirable or inconvenient, depending on how you looked at it. She found him sitting against the port side fuselage wall about 10 feet from Okafor, with his jacket off and his dress shirt open at the collar, holding his left side with a specific, careful pressure that she recognized as the unconscious self-bracing of someone with rib injuries. He was watching her work, had been watching her since she'd boarded, she realized. He had the alert, assessing quality of a man in pain who was managing that pain through attention to something other than himself. "Senator Whitmore." "That's me." His voice was controlled, but the effort behind the control was visible. "I've been watching you work." "I know." She crouched beside him. "I need to assess you. Can you take a slow breath for me?" He tried, stopped halfway through with a sharp, involuntary hiss. "On a scale of 1 to 10. 7, maybe 8. A pause. I'm not going to say 10. I've seen 10 tonight. She pressed carefully along his left rib cage. 3, 4 ribs with significant tenderness, the 4th and 5th with the particular give that indicated fracture rather than bruise. Any shortness of breath besides the pain? Some. Not like Sergeant Okafor was. Your breathing mechanics are intact. I think you have multiple fractured ribs and likely a small hemothorax, blood between the lung and the chest wall. It's painful, and it needs treatment, but it's not immediately dangerous if you don't exert yourself. What does that mean in practical terms? It means I need you to stop trying to help your colleagues, and let me do my job. He looked at her. Then he almost smiled. Not quite, because smiling when your ribs are fractured is an act of will, but the ghost of it was there. Someone briefed me on the call sign. Angel 6. She said nothing. They told me you'd be direct, he said. Rest, she said. I'll be back to you. She stood and went back to Rains. The chest tube went in cleanly. Rains had good hands, genuinely good surgical hands, and Okafor tolerated the procedure with the kind of stoic grimness that spoke to both his training and his awareness that the alternative to tolerating it was not tolerating it, which was worse. His saturation climbed back toward 94 by the time Rains had the drainage secured, and Emily felt the specific quality of relief that came not from the absence of crisis, but from the successful management of it, which was different, which was temporary, which meant you were permitted about 6 seconds to register it before you moved to the next problem. The next problem arrived in about 4 seconds. It arrived as a change in the aircraft's engine note, a shift in pitch from the port engine that was subtle enough that she might not have caught it if she hadn't spent time on military aircraft. But she had, and she did, and she turned to the Marine corporal she'd tasked with the fuel vapor question, who was holding a radio with an expression that confirmed her read. What did the cockpit say? She asked. Port engine is running rough. Pilot says they're managing it, but they're reducing power. What's our ETA to the plateau? 40 minutes. She looked at Rains. He'd heard it. His expression didn't change, but something behind it sharpened. 40 minutes was manageable if everything held. 40 minutes became a different equation if the port engine continued to deteriorate, or if Okafor's drainage indicated more bleeding than the initial decompression suggested, or if Muldoon's ICP was building faster than she could monitor for. She went back to Muldoon. He was worse. Not dramatically. She'd seen dramatic, and this wasn't that yet. But the right pupil was more sluggish than it had been 15 minutes ago, and his GCS had dropped another point. He was answering questions, but slowly, like someone responding through gauze. The Marine assigned to him had been doing his job. She could see that, and his expression when she crouched down had the particular quality of someone who had been hoping she would return and now needed her to tell him something useful. He's been like this for about 10 minutes, the Marine said. Got a little better right after you talked to him. Then he kind of leveled off. Has he vomited? Once, about 5 minutes ago. She checked her watch. 38 minutes to the plateau. She looked at Muldoon, at the bruising that had deepened in the last 20 minutes, at the right pupil that was doing what right pupils did when pressure was building inside a skull. She needed a surgeon. She needed a CT scanner. She needed a neurosurgeon at the end of a 38-minute flight who would be ready to move the moment the aircraft touched down. She could not do neurosurgery on the floor of a C-130. What she could do was keep him oxygenated, keep his head slightly elevated, keep anyone from jostling him, and monitor aggressively for the signs she was most afraid of. She radioed the Blackhawk. This is Carter. I need the ground team at the plateau to have a neurosurgeon on standby. We have a TBI with progressive pupillary asymmetry. GCS is declining. He's going to need immediate surgical evaluation on landing. Garrison's voice came back. Copy that. We're getting you trauma surgery, not a dedicated neuro. Best available given the location. Best available is acceptable. I need them gloved and ready at the ramp. Understood. She was still crouched by Muldoon when Logan appeared beside her, which meant Reyes was stable enough that he could leave her. Reyes's pressure is coming up, he said. BP 89/60 and climbing. Good. What are we doing about Muldoon? Monitoring and praying for 38 minutes, she paused. Monitoring. Forget I said the other part. Logan almost made a sound that was almost a short laugh. In different circumstances, it might have been one. You've never prayed in your life, Carter. I've prayed. I just usually coupled it with doing everything in my power to not need the answer. He looked at her for a moment. The aircraft bucked through a pocket of turbulence and they both shifted their weight automatically, the way people did who had spent time on moving platforms. And when it passed, they were looking at each other in the particular way that people looked at each other when they'd spent too much time apart and had too much to say and were currently in no position to say any of it. We should probably talk, Logan said. We should definitely talk, Emily said. Later. Yeah. He looked at Muldoon. Later. She stood. Her knee sent up a complaint that she acknowledged and dismissed. I'm going back to the senator. You stay on Muldoon. You do not leave him. I hear you. Logan. She waited until he looked at her. If his right pupil blows, if it goes fixed and dilated, you come get me running, not walking, running. He understood what she meant. A blown pupil on a TBI was herniation, and herniation was the thing she couldn't fix at altitude with the tools she had. I know, he said. She believed him. Senator Whitmore had not listened to her instruction to stop helping. When she got back to him, he had one arm around Okafor's shoulders, helping the man sit up slightly to ease his breathing, which was actually the correct instinct, even if it wasn't what she'd told him to do. I said rest, she said. I was resting. Then he needed to sit up and his medic was busy. Whitmore looked at her steadily. I can help and be still, or I can be still. Which is more useful? She assessed him for a second. He was pale, breathing carefully, clearly in pain, but his color was holding and his effort of breath was controlled. Help him sit, and then you stop. Deal. She worked the senator's chest, full assessment, auscultation as best she could manage in the ambient noise, palpation, watching his work of breathing over 3 full respiratory cycles. The hemothorax was small. She was increasingly confident of that. Small hemothorax in an otherwise healthy man in his late 50s who was not on anticoagulants was not good, but it was manageable with close observation, and close observation was the best she could offer at altitude. When they landed, he would need a drainage procedure and imaging. For now, he needed to breathe slowly and not agitate his chest wall. You need to understand that if your breathing gets significantly worse, she told him, I'll need to intervene and it won't be comfortable. If it keeps me breathing, I'm not going to argue. Good. She taped a pulse oximeter to his finger. She'd liberated it from the supply bag on the helicopter. If this drops below 90, tell me immediately. Understood. He looked at Okafor, who had his eyes closed and his breathing under better control. Then at Reyes, still at the far end of the cabin, with Logan's work visible in the neatness of her dressings and the IV running smoothly. They're going to be okay? I'm working toward that outcome. That's not a yes. No, she said. It's not. He seemed to appreciate the honesty. She'd noticed that, in the field, in the ER, in this broken aircraft, people in real trouble almost always preferred the honest version to the comfortable one. It was only in the absence of real danger that people started wanting reassurance over accuracy. She went back to working the cabin. The next 20 minutes were the kind of minutes that seemed shorter than they were from the inside and longer than they were from the outside. A sustained, methodical engagement with the specific problems in front of her, cycling between patients, checking vitals, adjusting, monitoring, adjusting again. Okafor's drainage showed 400 milliliters of blood and then slowed, which was exactly the course she'd hoped for. Reyes's blood pressure climbed to 98/64, and her skin was warming slightly. The blast concussion patient vomited a second time, and Emily got a basin under him and checked his pupils and decided he was miserable but stable. Muldoon was the one she kept coming back to, kept checking, kept measuring against her last reading. At 32 minutes to landing, he vomited. At 28 minutes, the Marine watching him appeared at her elbow with an expression that made her stomach do something that was not useful. His right eye, the Marine said. She was moving before he finished the sentence. She crouched by Muldoon and put her penlight to his right eye and felt the thing she'd been afraid of. The absence of response where there should have been response. The fixed, blown quality of a pupil that had lost its function because the pressure behind it was doing something that could not be undone from the outside. "Muldoon," she said, loud. "Open your eyes." He opened them. One was normal. One was the wrong size. GCS was down to 7. She did the calculation in 6 seconds, 28 minutes to landing, ground team with trauma surgery standing by, no neurosurgeon, no OR, no way to relieve intracranial pressure from inside a C-130 flying through a Montana mountain storm. What she had was a decompressive option that was battlefield-derived, that she had seen performed once in controlled conditions, that required equipment she was not certain she had in the quantities she needed, and that she had never done herself. She turned to find Rains was already there behind her, which meant he'd been watching for this possibility too. "I see it," he said. "We're 28 minutes out." "I know what 28 minutes means. Can you do a burr hole procedure?" He didn't answer immediately. That was honest. She respected it. "I've done it in surgical conditions," he said. "Once, in a hospital OR. That was once more than I've done it. Emily." He almost never used her first name. She noted it. "If I miss the mark, or if the bleeding is venous, if we don't do something his brain herniates before we land." She said it flat. Not to be harsh, just to make sure the shared understanding was clear. "We have 2 choices, and one of them is doing nothing." He looked at Muldoon, at the blown pupil, at the unconscious, labored quality of his breathing that had been normal 20 minutes ago. "What do we have in the supply load for this?" he asked. She was already going through the bag. She found the hand drill. She found the drill bit. She found the Foley catheter they could use for drainage. She found the irrigation solution. She inventoried what she did not have and cross-referenced it against what she could improvise with, the way she'd been trained to do, the way she'd done so many times that the mental calculus was almost automatic. "It's not a surgical kit," she said, "but it's close enough." "Close enough," Rains repeated. He looked at it for a moment, then at her. "You've seen this done. You know the landmarks." "I know the landmarks." "Then you guide me. Hands and voice." "Okay. If this goes wrong..." "Rains." She met his eyes. "If we do nothing, it goes wrong for certain. This gives him a chance." He took a breath, steadied himself against the vibration of the airframe. Around them, the cabin had gone quiet, in the particular way that people got quiet when they understood that something very significant was about to happen, and that the right thing was to get out of the way and let the people who knew what they were doing do it. Logan appeared to Emily's left. He'd heard. He had his hands already prepped, gloves on, a suction bulb he'd found somewhere, and a collection of improvised retractors made from bent tubing that she hadn't asked for but immediately understood the usefulness of. "Position and instruments," he said. She looked at him. "You can tell me to go away," he said. "But you've got a flight surgeon who needs his hands free and a procedure that needs more than 2 people. I know the field version of this. I've assisted on it twice." She hadn't known that. She looked at his face to see if it was true. It was true. "Position," she said, meaning where to stand. "Left side," he said, and moved there. The 3 of them arranged themselves around Staff Sergeant Muldoon, who was 41 years old and breathing and alive in a way that would only remain true if the next 20 minutes went the way they needed to go, and the aircraft groaned and shook around them, and the storm outside pressed close against the windows, and somewhere below them the plateau was getting nearer. Emily looked at Rains. He nodded. She put her hands where they needed to go. "Find the landmark," she said, her voice steady, her eyes steady, everything about her that needed to be steady. Steady. "Coronal suture. Mid-pupillary line. 2 centimeters anterior. You're going to feel it." Rains's hands moved. The aircraft hit the worst turbulence of the flight, a full-body shudder that lasted 4 seconds and felt like twice that. And Emily held position, and Rains held position, and Logan held position, and when it cleared, she said without wavering, "Again, find it again." He found it. "There," she said. And then the drill went down, and the cabin of the broken aircraft was very, very quiet. And Staff Sergeant Muldoon's next breath was still there, but his pupils were not the same. and 22 minutes of flight time remained, and what happened in the next quarter hour would either mean she had bought him enough time or it would mean she had not. And the only way to know which one was to keep going, to keep his airway clear and his position correct, and his vitals tracked, and Raines's hands where they needed to be, and so that was what she did. She kept going. And somewhere in the middle of all of it, between checking Reyes's IV line and calling Muldoon's vitals to Raines and reaching past Logan to adjust the drainage angle, she heard the aircraft's intercom crackle and the pilot's voice, strained and controlled, say the thing she had been waiting for him to say since the engine note changed 45 minutes ago. Medical team, port engine is failing. We are declaring emergency. ETA to landing is now 11 minutes. I cannot guarantee a smooth approach. 11 minutes. She looked at the drill in Raines's hand. She looked at Muldoon. She looked at the pupils. And the right one, the blown one, flickered. Just slightly, just barely. But it moved. She looked at Raines. It's working, he said, and his voice was doing the thing that voices did when the relief was real, but there was no time for it yet. Keep going, she said. 11 minutes. And somewhere behind her, from the direction of the senator, a voice said quietly and without drama, Nurse Carter. She turned. Whitmore's face was gray. His oximeter was reading 83. She crossed the cabin in 5 steps. Whitmore's face had gone the color of wet concrete and his breathing had changed. Not dramatically, not yet, but in the specific way that breathing changed when the space inside the chest was filling up with something that didn't belong there. Small hemothorax had been her read 40 minutes ago. Small hemothorax didn't stay small when fractured ribs kept moving against damaged tissue with every labored breath. I can feel it, he said. His voice was remarkably calm. The pressure. It's been building for about 10 minutes. Why didn't you tell me 10 minutes ago? You were drilling into someone's skull. She couldn't argue with the triage logic. She pressed her fingers along his left side, felt the resistance that hadn't been there before, watched his chest move and saw the asymmetry, the left side expanding less than the right, the body compensating the way bodies compensated when one lung was being compressed into a smaller and smaller space. Raines, she said, not loudly. He heard her anyway. I can't leave Muldoon. I know. I'm not asking you to. She looked at Logan. Logan was holding Muldoon's head position. She looked at the Marine corporal she'd used before, the one with the tourniquet on his arm, who'd been functional and useful throughout. Corporal, come here. He came. I need you to maintain exactly this position on Sergeant Muldoon. Watch Captain Raines's hands. Do what he tells you. Don't move anything he doesn't tell you to move. Yes, ma'am. Logan transferred position to the corporal, checked once that the hold was correct, and came to her without being told. That was the thing about Logan in operational settings. He didn't need to be managed. He read the situation and moved. She needs a needle thoracentesis, Emily said quietly between them. Second intercostal, mid-clavicular. Yes, I'll do it. I need you to hold him upright and still. Her, Logan said. What? Private Reyes is she. Senator Whitmore is he. He was already positioning himself behind Whitmore, getting his arms under the man's shoulders to stabilize him. She blinked. The pronoun error had come from 7 things happening at once and not enough sleep in the last 30 hours. Senator, I'm going to insert a needle to drain the fluid. It will relieve the pressure immediately, but I have to warn you it's going to hurt. Worse than the ribs? Different. He looked at her. Do it. She did it. She found the landmark, prepped the site with what she had, and went in with the 14-gauge angiocath from her vest. The resistance was there, then it wasn't, and then the blood, darker than arterial, venous blood, which was better, began to flow, and Whitmore made a sound that was involuntary and short, and then his next breath was measurably easier than his last. That's, he started. Don't talk. Breathe. He breathed. She watched the oximeter climb. 83, 86, 89. It stopped at 91 and held. Not great. Acceptable. Logan, I need a flutter valve on this. He had already improvised one from a glove finger and the suction tubing. She'd seen the same field improvisation twice before in her career, and it always impressed her that the same solution appeared independently when people who understood the physics were working without equipment. He secured it. She taped the catheter. "Still," she told Whitmore again. "I understand still," he said. She stood and turned back to Rains and Muldoon and the 11 minutes that had become 8. Amkit. Muldoon's right pupil was responding. Not fully, not the brisk bilateral response of a healthy nervous system, but a genuine response. A partial constriction that indicated the pressure on the brainstem had eased enough to allow some function to return. Rains had the drainage established, and his face had the quality of a man who had done something very hard and was not yet ready to believe it had worked. "GCS," Emily said, crouching. Rains ran it quickly. 9. Up from 7. 2 points was significant. 2 points in this direction, in this time frame, meant the procedure had done what it needed to do. It did not mean Muldoon was out of danger. He needed imaging and a neurosurgeon and an OR, and none of those things existed on this aircraft. But it meant he had more time than he'd had 12 minutes ago, and more time was the only currency that mattered right now. "Maintain the drain," she said. "Watch for any drop in his pressure. If his SAT falls below 90, we've got a secondary problem." "Copy." She stood and did a full cabin scan. Her brain was running the kind of simultaneous processing that happened under sustained extreme stress. Not calm exactly, nothing like calm, but a kind of directed focus that felt like calm from the outside and felt like controlled fire from the inside. Okafor, stable, drainage slowing, SAT 95. Reyes, BP 102/68, warm, responsive, 1 tourniquet due for assessment before landing. Muldoon, post-procedure, monitored, GCS improving. Whitmore, 91%, flutter valve in place, pain managed with what they had. 5 remaining casualties, all status green or status yellow, none status black. She allowed herself 3 seconds to register that. Then the pilot's voice cut through the intercom again. "Medical team, this is Captain Dre. We are beginning emergency approach. I need all personnel seated or braced. I cannot promise a clean landing. The starboard main gear indicator is showing anomalous. Repeat, landing gear status is uncertain. Brace in 30 seconds. Emily looked at the cabin. 8 Marines, 1 senator, no seats, no harnesses for most of them. Okafor with a chest tube, Muldoon with a cranial drain, Reyes with IV lines, and 2 fractured legs and improvised splints. She made 4 decisions in 2 seconds. Rains, Muldoon's drain, stabilize it against your body on landing. Do not let it pull. If the aircraft hits hard, the drainage tube can't move. Understood. Logan, Reyes, same principle on her IVs, and you need to protect her legs. Get behind her, brace against the fuselage, take the impact for her if the landing is rough. He was already moving. Corporal, she flagged the tourniquet corporal again. Get every walking wounded braced against the fuselage. Low position, feet against the floor supports. She went to Whitmore. He looked at her. You need to stay completely still on landing, she said. If the catheter moves, it's going to hurt, and we could lose the drainage. Can you brace yourself with your right arm only? Yes. Do it now. She positioned herself between Okafor and the forward bulkhead, put her back against the wall, and braced her feet against the floor track that ran the length of the cargo deck. She put one hand on Okafor's chest drain line to stabilize it. 10 seconds. The C-130O's engine note changed, a reduction in power that preceded approach, and the aircraft nosed down, and everything in the cabin that wasn't secured shifted slightly forward with the physics of the descent. And Emily heard the landing gear attempt to deploy, heard the mechanism engage, and heard the sound that followed, which was not the sound it should have made. 5 seconds. The plateau appeared in the small windows as a dark mass rushing upward. She took one breath. The aircraft hit. It hit hard. Harder than a normal landing. A full-body impact that traveled up through the cargo deck and into every human body braced against it. And there was a secondary impact half a second later as the starboard gear failed to lock and the wing dipped, and the aircraft skidded 8 degrees to the right before the braking systems caught it and the drag chute deployed and the whole thing decelerated in a way that was violent and also, critically, controlled. The shriek of tires on frozen ground lasted about 4 seconds. Then silence. Not true silence. Engines were winding down. The aircraft's structure was ticking and settling. Someone somewhere in the cabin was making a sound that was either crying or coughing. But the particular silence of a thing that has stopped moving when it was not sure it would stop. Emily ran her hands over Okafor's drain line. Intact. She looked at Rains, who was still braced over Muldoon with both hands on the drainage tube. He raised his eyes to her. "Good," she said. She was on her feet before the ramp finished dropping. The cold hit first. That savage Montana October air, knifing through the cargo doors. And then the lights hit. The portable flood lamps the ground crew had set up on the plateau, and beyond them were vehicles, personnel, a mobile surgical unit she hadn't been promised but was extremely glad to see. "Ramps down!" someone outside was shouting. "Medical team, we have trauma surgery on site. What do you need first?" "TBI, cranial drain in place, GCS-9 and climbing," she called back, voice carrying across the plateau without effort. The years of shouting over rotors and engine noise having calibrated her volume for exactly this. "He goes first. Neurosurgical emergency. Second priority is the chest tube. He's stable, but needs imaging now. Third is the bilateral leg fractures. She's resuscitated, but surgical. VIP is fourth. Hemothorax flutter valve in place, 91% SAT. A surgeon in full gear was already on the ramp. "I'm Dr. Nolan Parrish, trauma surgery. I heard about the burr-hole procedure. Captain Rains performed it. He can brief you on the approach." "Who guided it?" She looked at him. "I guided it. Can we move the patient?" Parrish looked at her. At the vest. At the scrubs. At the blood on her sleeve that wasn't hers. And made some calculation behind his eyes. "Yes," he said, "we can move him." They moved him. The next 40 minutes were a different kind of organized chaos, the kind that existed on the other side of the acute crisis, where the decisions had been made and the consequences were in the process of being determined, and all you could do was hand off cleanly and trust the next tier of care. She gave each handoff herself, standing next to each patient as they were moved, giving the receiving team exactly what they needed and nothing they didn't. The kind of report that told the story of the last 2 hours in clinical language that was also, if you read between the lines, a record of everything that had been improvised and why. Rains found her when it was done. He was leaning against the side of one of the ground vehicles with his arms crossed and an expression she recognized as post-adrenaline flatness, the crash that came after the surge, when your body finally registered what it had been running on. "Muldoon," he said, "I need to know if I did it right." His GCS was 7 and trending down. Now it's 9 and holding. The decision was right. The procedure was right. "I've never done it outside of a controlled environment." "I know." He was quiet for a moment. "You built the confidence for it. In the moment." She looked at him. "You built the skill. I just reminded you it was there." That seemed to mean something to him. He nodded once and pushed off the vehicle. She walked toward the plateau perimeter, where the ground dropped away into darkness, and the storm that had been chasing them was visible to the northwest as a wall of cloud backlit by lightning, still moving but no longer their problem. Her knee was throbbing. She never noticed during TIC, but now that the acute phase was over, her body was presenting its invoice. She shifted her weight, stretched the knee slightly, and stood there for a moment in the cold and the dark and the relative quiet of a crisis that had not fully resolved, but had been brought to a point where other people could carry it forward. Logan found her there. She'd expected he would. She'd also expected she wouldn't know what to say when he did, and she was right about that too. He stood beside her for a moment without speaking, which was something she had always appreciated about him, that he understood silence as a thing that didn't need to be filled. "Reyes is in surgery," he said finally. "They said the vascular anatomy is intact. She's going to keep the legs." "Good." "Whitmore's saturation is 97. They drained another 400 milliliters." He was asking about the team. He was asking about Okafor. He was asking about all of you. She turned slightly to look at him. He was doing the same thing she was doing, looking at the storm, using the distance to manage proximity to whatever the actual conversation was. "You didn't tell me you'd done the field version of a burr hole," she said. "You didn't ask." "I didn't know to ask." "No." He paused. "There are things I didn't know to tell you, back then and after." She waited. This was the place in the conversation where it either went somewhere or didn't, and she was too tired and too cold and too present in her own body to manage it carefully. "You could have found me." "I tried to find you." "You tried once." He was quiet. "I moved twice in 8 months," she said. "I wasn't hiding. I was reorganizing." She heard how it sounded. "I wasn't hiding." "I know," he said. "I know you weren't hiding. I just didn't know if you wanted to be found. After the discharge. After everything." The discharge. Everything. 2 words standing in for 18 months of a period she'd largely stopped discussing because discussing it required revisiting it, and revisiting it had a cost she'd gotten out of the habit of paying. "Logan." "Yeah. I'm glad you were here tonight." He turned his head to look at her. She was looking at the storm. "Professionally?" she added. "I'm glad you were here professionally." "Emily." "Don't, I'm not doing anything. I just..." He stopped, started again. "I should have looked harder." She had 14 things she could have said to that. She said none of them because the ground crew was suddenly moving, suddenly converging on one of the surgical tents with a speed and urgency that had a different quality than routine movement, and a voice carried across the plateau that she heard clearly even at distance. "We're losing him. He's coding. Get Carter. Someone get Carter." She was already running before the echo died. Her knee screamed. She ran anyway. The surgical tent was 50 yards. She covered it in seconds, hit the entrance, pushed through, and stopped. Okafor was on the table. The monitors told the story before anyone could say it. VFib, the chaotic electrical signature of a heart that had lost its rhythm. The defibrillator charging, Parrish's team moving with the compressed efficiency of people who'd been here before, but whose hands were moving faster than was comfortable. But it wasn't Okafor they'd called her for. The second table. Senator Dale Whitmore was on the second table, and his monitor showed the same pattern, and the team around him was smaller, and one of them looked up when she came in and said the thing that turned the next 10 seconds into something she would not be able to fully reconstruct afterward. "He arrested 30 seconds ago. We think it's an air embolism. The catheter shifted on landing, and we think we introduced air when we repositioned him. We don't have the equipment to..." "Move," Emily said. They moved. She was at the table. Whitmore's face was the color of paper. The monitor screamed its flat urgency. And what she was looking at, the specific configuration of a venous air embolism, the physics of it, the anatomy of it, the narrow window in which the intervention she was formulating in real time was either possible or not, required something she had done exactly once before, in a forward operating base in a country whose name she didn't say, with instruments improvised from what was present and a field surgeon talking her through it step by step. There was no field surgeon here. There was a trauma surgeon 6 feet away working to save a different life. There was Logan Pierce, who had appeared at her elbow again, because Logan Pierce apparently went where she went, which was a fact she would examine later, and his face showed that he understood exactly what she was looking at. "Tell me what you need," he said. She looked at Whitmore, looked at the monitor, looked at the clock on the tent wall. She needed a central line, a specific positioning maneuver, aspiration of the air from the right atrium, and she needed it in the next 90 seconds, or the cardiac output would drop below the threshold of recovery, and Whitmore would die on a plateau in Montana, with the storm finally arriving overhead and 8 Marines alive because of decisions made in the last 2 hours. She needed all of that, and she had a 14-gauge angiocath, a 60-milliliter syringe, and Logan Pierce. "Left lateral Trendelenburg," she said. "Now." He moved Whitmore. She found the subclavian. The tent filled with the sound of the other monitor stabilizing, Okafor's rhythm converting, Parrish's voice saying, "Good, hold, hold." And somewhere behind her the storm hit the plateau with its first real gust, and the tent wall bowed inward, and Emily held the needle completely still and found the landmark and went in and pulled back the plunger. The syringe began to fill. Not blood. Froth. Air blood mixture, the distinctive catastrophic bubble of an embolism being evacuated. The monitor changed, slowly, one beat, then another, then a rhythm that was wrong, and then less wrong, and then almost right. She held the needle and did not move and watched the monitor climb back from the edge and cross the threshold and keep going, and she breathed for what felt like the first time since she'd walked into the tent, and Logan beside her made a sound that wasn't quite a word but carried the full weight of one. Whitmore's eyes opened, unfocused, frightened, present. He looked at the ceiling of the surgical tent. He looked at the chaos around him. He found her face. His mouth moved. She leaned closer. Is this... His voice was barely there. Is this what you do every day? She straightened. No, she said. Some days are harder. And then Parrish was behind her and the team was around the table and the handoff happened and she stepped back, one step and then two, and felt the cold air from the bowed tent wall on the back of her neck, and Logan's shoulder was 6 inches from hers. And the monitors in the tent were all showing rhythms, actual rhythms. Not the desperate scramble of the last 90 seconds, but the steady, insistent evidence of hearts that had decided to keep working. All of them. Every person who had boarded that aircraft was still alive. She looked at her hands. They were still. They had been still throughout. She had always been able to rely on that. But as she looked at them now, she noticed, with some detached corner of her awareness, that they were shaking. Not much. Just enough. And before she could process that, before she could process any of it, the tent flap opened and General Decker stepped in, and behind him were 2 men she didn't recognize, and one she did, and the one she did was Deputy Director Garrison, and Garrison had an expression she couldn't read, and Decker looked at the monitors, at the patients, at the medical team, and finally at her. "Carter," he said. She looked at him. "There's something you need to know," he said. "About Pine Ridge. About tonight." He paused. "About Dr. Brooks." The wind hit the tent again. The light swayed. Emily waited. Decker didn't make her wait long. He stepped aside and let Garrison take the floor, which told her something about the nature of what was coming. Military men stepped aside for bureaucrats when the problem was no longer tactical, when it had become institutional. Garrison had the flat effect of someone delivering information he'd been carrying for a while and was finally permitted to set down. 3 hours ago, while you were in the air, Garrison said, we received a formal complaint filed against you with the Montana State Board of Nursing, time-stamped 6:47 p.m., 40 minutes after you departed this hospital's roof. She looked at him, said nothing. The complaint was filed by Dr. Ethan Brooks. It alleges that you misrepresented your credentials to military personnel, that you departed your assigned post without authorization, and that your actions constituted unprofessional conduct endangering patient care at Pine Ridge Regional. Garrison paused. He also contacted the hospital's legal counsel and initiated termination proceedings. The tent was quiet. Outside, the storm was doing what storms did, indifferent, ongoing. He filed it 40 minutes after I left, she said. Yes. While 8 people were injured on an aircraft. Yes. She absorbed that, not the fact of it. She had spent enough time around people like Brooks to understand that institutional self-protection moved fast and didn't require the crisis it was responding to be resolved first. What she absorbed was the specific shape of it, the speed, the precision, the particular malice of a man who had heard the words Angel 6 and understood, in that moment, that everything he told himself about Emily Carter was wrong, and had responded to that understanding not with recalibration, but with acceleration. What's his ground? She asked. Legally. He claims you concealed your military service history during your hiring process, that you submitted a civilian resume that omitted material professional experience. I submitted a civilian resume for a civilian position. He says the omissions constitute misrepresentation. General Decker, who had been standing with his arms crossed and an expression she couldn't read, spoke for the first time. The complaint has no legal merit. Your military service record is protected under federal privacy law, and you were under no obligation to disclose it on a civilian application. We have a JAG officer who will put that in writing before midnight. Then why are we having this conversation? Because, Garrison said. The board complaint triggers an automatic investigation, which means that as of tonight, your nursing license is under review, which means I can't practice, she said. Silence. She understood. All of it in sequence. Brooks had moved fast enough and precisely enough that even if every charge failed, even if the JAG letter cleared her, even if the military came out publicly and confirmed everything, the mechanics of the complaint would run their own course on their own timeline, and until that timeline resolved, she was suspended from the profession she had spent tonight doing. There was something almost elegant about it, if you could set aside the fact that it was also profoundly ugly. He knew about the board process, she said. Garrison didn't answer, which was its own answer. He's been in hospital administration for 20 years. He knows exactly how long an investigation takes and what it prevents during that period. She looked at Decker. He filed it fast enough that it preceded any public statement from your office about tonight. Yes, Decker said. So if the board investigation runs before the military's account becomes public record, the default assumption is that you exceeded your authority, that you misrepresented yourself. Garrison's voice was controlled. Yes, we are aware of the sequence. She looked at him for a long moment. Then she turned away from both of them and looked at the monitors, at the rhythms that were all present, all accounted for, all continuing because of what had happened in the last 3 hours. What do you need from me? She said. A statement, Garrison said. Tonight, detailed. Every decision, every procedure, the full chain of events from the moment you received the activation request. I can do that. And, Decker said, we need you to understand that this is not a fight you're in alone. The Marine Corps has 8 men alive because of what happened on that aircraft. The Armed Services Committee has a senior member alive because of what happened in this tent 20 minutes ago. He paused. There will be a public account. The question is the timing. The timing has to be before the board moves on the investigation. We understand that. Do you understand that he has a 12-hour head start? Carter, Decker's voice had the weight of a man who had made many decisions under pressure and was making another one now. We understand exactly where we are. We are not leaving you in front of this. She believed him. She also knew that belief and outcome were two different things, and the space between them was where things went wrong. So she gave the statement in the back of one of the military vehicles, sitting across from a JAG officer who had been flown in by the 3rd Black Hawk and who worked with a recorder and a tablet and the focused efficiency of someone who understood urgency. It took 40 minutes. She was thorough. She named every decision and its clinical basis, every improvisation and its physiological rationale, every moment where the training she'd received in 6 years of military service had been the direct cause of a specific person continuing to breathe. Logan sat outside the vehicle the entire time. She could see his silhouette through the window. She didn't know if he was waiting for her specifically or just hadn't found anywhere else to be, and she didn't examine that question too carefully. When she emerged, the storm had passed the plateau and moved south. The sky to the north was clearing in the particular way that mountain skies cleared after weather. Fast, absolute, like a decision being made. The temperature had dropped another 8 degrees. Logan handed her a cup of something hot. Coffee, or the military approximation of it. How bad? He asked. Brooks filed a board complaint before the aircraft landed. He was quiet for a moment. I don't have a word for that. I do, she said. But it's not useful. What happens now? Military JAG files a counterstatement. Garrison's office contacts the board. The timeline becomes a race. She drank the coffee. It was terrible. She drank more of it. It'll sort out. Will it? She looked at him over the rim of the cup. Tonight, yes. That's all I'm managing right now. He accepted that. He was good at accepting the boundaries of what a conversation could carry. Okafor, she said, stable. They're monitoring him overnight, surgery in the morning to clean up the drain site. Prognosis is good. He paused. Muldoon is in the mobile surgical unit. They did imaging. The burr hole released a subdural that would have been unsurvivable at altitude. She heard that carefully. Unsurvivable, she repeated. That's the word Parrish used. She looked at the coffee, at her hands around it, still steady, the shaking from earlier having resolved somewhere in the last 40 minutes of deliberate, focused statement giving. The brain was good at that, finding tasks to hold on to when the emotional processing needed to be deferred. Logan, yeah. When this is resolved, when the paperwork is done and people are in beds and everything is handed off. She stopped, started again. I want to have that conversation. He looked at her. She was looking at the northern sky. The one we didn't have, she said. Okay, he said. Just that. Okay. No inflation of it, no pressure on it. She appreciated that more than she could have explained at that particular moment. They were airborne by 0200 hours, back in the Black Hawk, heading south toward Silver Falls with the plateau disappearing behind them. Casualties would transport to regional trauma centers by medical transport, all of them, including Muldoon, who was stable enough for ground transport with a medical team riding alongside. Senator Whitmore had been moved to a private transport that would take him to the nearest hospital with a full cardiothoracic suite, which was in Billings, 4 hours by road, 2 by air. Before the senator's transport left, he had asked to speak with her. She'd stood at the door of the ground transport and he'd been inside, partially reclined, with monitors on and a nurse from the ground team watching him. He'd looked considerably better than he had 45 minutes ago. Still pale, still careful with his breathing, but present in his eyes in a way that had been uncertain for a while. I want to understand something, he'd said. She'd waited. That doctor, at the hospital, he told you to stay in triage. Yes. And you've been working there. How long? 11 months. He'd looked at her with the particular expression of a man who had spent his career in rooms where power was negotiated and was very familiar with the specific texture of institutional dismissal. And nobody asked. Nobody looked at the file. I didn't offer the file. I was done with that chapter. Were you? She'd considered it. I thought I was. He'd been quiet for a moment. I'm going to make some calls in the morning. Senator, you don't, not for you specifically. I mean, yes, for you specifically, but also because what Brooks did tonight with that complaint is the kind of thing that shouldn't be possible to do to someone who just saved 8 lives. And I sit on the committee that writes the rules about what's possible. He'd paused. I'm going to make some calls. She hadn't argued further. He meant it, and he had the standing to do it. And arguing with a senator about whether you deserved institutional protection after saving his life had a kind of absurdity that didn't escape her. Rest, she'd said instead. Breathe slowly. He'd almost smiled. You really only have the one mode. It served me. She'd walked back to the Black Hawk. They landed at Pine Ridge Regional at 0310 hours. The hospital was different at 3 in the morning than it was at shift change, and also the same fluorescent light in the bay, the same smell of antiseptic and recycled air, the same low hum of a building that never fully slept. What was different was who was waiting. Garrison had called ahead. She understood that when she came through the ambulance bay doors and found 2 men she didn't recognize, suits, federal ID, the specific posture of people who had been given a task and were executing it. Standing near the nursing station with the hospital's administrator, a woman named Dr. Lynn Ostroff, who had the look of someone who had received a significant phone call in the last hour and was still processing its implications. Brooks was there too. He was standing near his office door in street clothes. He'd apparently been called in. And he had the contained, watchful quality of a man who had made a move and was waiting to see how the board responded. He looked at Emily when she came through the doors. His expression was difficult to read. Not guilty. Men like Brooks didn't do guilt in the conventional way. More like assessment. He was taking in the vest, the blood on her sleeve, Logan behind her, the 2 federal agents near the station, and recalibrating. She walked past him without stopping. Carter? His voice was controlled. We need to talk about Dr. Brooks. Garrison had come through the bay doors behind her and spoke before she could. I'm Deputy Director Alec Garrison, Joint Operations Medical Support. I have a JAG statement from the U.S. Army Judge Advocate General's office regarding your complaint to the Montana State Board of Nursing, and I need to speak with your administrator. Now. Brooks looked at Garrison, at the men by the nursing station, at Ostroff, whose expression had moved from processing to something colder. The complaint was filed on legitimate grounds, Brooks said. She concealed, the JAG statement addresses that in full. Garrison's voice was not raised. It was very flat. The flatness was worse than volume. Dr. Ostroff, is there a conference room? Ostroff looked at Brooks for 1 second, a look that contained an entire conversation about what the next several hours were going to be, and then looked at Garrison. Yes, this way. Emily stood at the nursing station while Garrison, Ostroff, and the 2 federal contacts disappeared into the conference room. Logan was beside her. Priya was behind the station, on night shift, and she was looking at Emily with an expression that mixed relief with about 17 questions she was too professional to ask on shift. Are you okay? Priya asked. I'm functioning, Emily said, which was honest. The military called here, about 2 hours ago. They asked about your employment record and your shift assignments. Priya paused. And about Dr. Brooks. Emily looked at her. What did they ask about Brooks? About your evaluations? Who submitted them? What they said? Priya's voice dropped slightly. Emily, I pulled your file after they called. I shouldn't have, but I did. Your evaluations from the last 11 months, they don't match your work. They're consistent with someone they read like someone who barely meets minimum standards. But I've watched you work. I know what you do in this department. Emily was quiet for a moment. Who signed the evaluations? Brooks. All of them. She had suspected this. Suspected it in the abstract, unarticulated way that you suspected things that you had no evidence for and no particular desire to confirm because the confirmation required you to be angry, and being angry at Pine Ridge while she was still trying to figure out who she was in the civilian world had felt like a luxury she couldn't afford. It wasn't abstract anymore. How far back? She asked. First evaluation was at 90 days. It's marked, I don't want to say this wrong. Priya glanced around the nursing station and then back at Emily. It's marked as a marginal performer. Recommend close supervision. And there's a note. It says you have difficulty following physician direction and may struggle to adapt to non-military clinical environments. 90 days. She'd been there 90 days and he'd already written the template. Logan, beside her, said nothing. She appreciated the silence. Are there others? She asked. Other nurses? Other evaluations that don't match performance? Priya's expression told her the answer before the words did. I looked at 3 others, same pattern. Nurses who push back or who question orders or who are just women he doesn't get along with. She stopped. There's one from 4 years ago. A nurse named Sandra Okaye. She was terminated for performance issues. Another pause. Her patient outcomes were in the top 15% of the department. Sandra Okaye. She didn't know the name. She didn't have to know the name for the pattern to be fully clear. The conference room door opened at 0340 hours, and Garrison came out first, followed by Ostroff, whose face had completed its journey from cold to something that had made a decision. The 2 federal contacts stayed inside. Brooks came to the nursing station. He'd clearly been waiting. Lynn, he addressed the administrator directly, deliberately bypassing Emily and Garrison. The complaint is on record. The board investigation. The board has been contacted by the JAG office, Ostroff said. The complaint has been reviewed and the misrepresentation claim has been dismissed on federal grounds. Emily Carter was under no legal or professional obligation to disclose protected military service history in a civilian application. She paused. Ethan, we also need to discuss the performance evaluations. Something moved in Brooks' face. Small. Gone. Quickly. The evaluations are within my authority as, we've identified a pattern, Ostroff said, in your evaluations of nursing staff going back a minimum of 4 years. I've had HR begin a full audit of every evaluation you've submitted. She held his gaze. This is not a conversation for the hallway. You're going to come with me to my office, tonight. I don't think it's not a request, Ethan. The hallway was very quiet. A monitor beeped somewhere down the corridor. The night shift was continuing around them with the low-frequency awareness of staff who couldn't stop working but were tracking every word. Brooks looked at Emily. It was the look of a man who had deployed a weapon and watched it come back the wrong direction. There was no apology in it. She hadn't expected one. There was something more interesting than apology. There was the specific expression of someone who had built an understanding of a situation over 11 months and was now watching that understanding fail. She looked back at him steadily and said nothing. He turned and followed Ostroff down the corridor. Garrison came to stand beside her. The JAG statement also includes a summary of your service record. With your permission, that summary will be released to the hospital administration and, if necessary, to the board as part of the counter-filing. My permission, she said. It's your record. She had spent 2 years being done with that record, being the person who kept a trauma vest on a locker shelf and worked quiet shifts in a regional hospital and didn't need anyone to know what they didn't know. There was a version of her that wanted to continue being that person. She looked down the hallway where Brooks had gone. Release it, she said. Book. By 500, she had given a secondary statement to the hospital's HR director, who had arrived at 4 in the morning in clear distress and had spent the intervening hour on the phone with the hospital's legal team. By 05:30, she had showered in the hospital locker room and changed into a clean set of scrubs from her locker and sat in the break room with coffee that was better than what she'd had on the plateau, which was not a high bar. Logan found her there. He'd been somewhere, she didn't know where, handling the logistics of being a military-adjacent civilian who had participated in a classified military medical operation and needed to sort out what that meant for his paperwork. He looked tired in the way that she felt tired, which was bone deep, the kind of tired that was still 10 days from fully resolving. He sat across from her. She slid the second cup of coffee toward him. Ostroff suspended Brooks pending the investigation, he said. Priya told me when I came through the station. When? About 20 minutes ago. She pulled his access card herself. He picked up the coffee. Apparently he argued. He would. She told him the military had provided documentation of patient outcome disparities correlated with his nursing evaluations, and she had a legal obligation to act on it. Logan paused. She said it in front of 4 people in the hallway. Emily looked at her cup. She thought about Sandra Okeye, whose name she hadn't known 4 hours ago. She thought about the 3 other nurses Priya had mentioned. She thought about the 90-day evaluation and the phrase difficulty following physician direction and the particular cowardice of a man who had chosen paper as his weapon because paper didn't fight back. What happens to his license? Logan asked. That depends on what the HR audit finds and what the board does with it. Could be a reprimand, could be suspension, could be permanent. She paused. If the pattern goes back 4 years with documentation, the board has grounds for permanent revocation. Logan was quiet. It won't be fast, she said. Nothing institutional is ever fast. But it'll happen. She looked at him. Yes, it'll happen. He nodded, the way he'd nodded on the aircraft when she'd told him things that were difficult but true. She'd always appreciated that about him, that he didn't need things softened, didn't need the edges rounded off, just needed them said accurately. Her phone buzzed on the table. She looked at it. The number was a Washington, D.C. area code she didn't recognize. She let it go to voicemail. 30 seconds later, it buzzed again. Same number. She picked it up. The voice on the other end was the voice of someone's assistant. Efficient, unhurried, the practiced neutrality of people whose job it was to connect other people to the person they were actually calling for. Ms. Carter, I'm calling on behalf of Senator Dale Whitmore. He's currently in transit and asked me to reach you directly. He wanted to make sure you knew that he'll be speaking publicly about tonight's events at a press availability tomorrow morning. A pause. He also said to tell you, and I'm reading this directly, that he looked up the call sign. He said to tell you the name fits. She said thank you and ended the call. Logan was watching her. She put the phone face down on the table. Well, he said, Senator Whitmore is talking to the press tomorrow. That'll move things fast. Yes. How do you feel about that? She thought about it seriously because it was a serious question. She had spent 2 years building a life that was specifically designed to not require anyone to know who she was. The record that Garrison had just released, that had her permission to release, was going to become the public record. People were going to know. People at Pine Ridge were going to look at her differently. People were going to have opinions about who she was and what she deserved and what it meant, and she was going to have to exist inside all of those opinions while still being the person who had a bad knee and 3 plants in an apartment above a hardware store and had not yet fully figured out who she was when nobody was shooting at her. "I don't know yet," she said. It was the most honest answer she had. Logan seemed to accept that. He drank his coffee. She drank hers. Outside the break room windows, the sky was doing the thing it did in Montana in October, just before 5:30 in the morning. The very first gray, the kind that was barely different from dark, but was. She was almost at the place where she might have said something real when her phone buzzed again. She looked at it. The number was the hospital's main line, at 5:30 in the morning. She picked it up. It was Priya. Priya's voice had the quality of someone who was very controlled because the alternative was not being controlled. "Emily, I need you on the floor right now." "What is it?" HR pulled Brooks's files for the audit, all of them, going back to when he started here. A breath. "Emily, there's something in there that it's not just the evaluations. There are incident reports. Things that were filed and then marked closed with his signature as the reviewing physician. 3 patient complaints about nursing staff that were documented and then buried. And one—" Priya stopped. "Priya, one report from 14 months ago, before you arrived. A nurse filed a formal complaint about workplace harassment. Brooks reviewed it himself and marked it unfounded. The nurse left 2 weeks later." Another breath. "Her name was Sandra Okai." Emily stood up. "The HR director is here," Priya continued. "She's been on the phone with the state medical board for the last 20 minutes. But Emily, there's something else. The incident report from 14 months ago. There's a note attached, in Brooks's handwriting. The note says—" Priya's voice dropped. "It says the complaint was reviewed and dismissed because the nurse's performance history did not support credibility." Emily was already moving toward the door. "The performance history he cited," Priya said, "was the evaluation he wrote about her himself." She stopped walking. The break room was very still. He had written a bad evaluation, used the bad evaluation to invalidate a harassment complaint, used the invalidated complaint to force a resignation, and then, presumably, done it again and again and again, with different names until a pattern existed that he had buried under his own signature every time. 14 months of institutional cover, at minimum, possibly more. "Tell the HR director I'm coming," Emily said. She put the phone in her pocket. Logan was on his feet, reading her face. "What happened?" "It's worse than we thought," she said. She walked out of this break room and down the corridor toward the nursing station, where the morning shift was beginning to filter in and the hospital was returning to its daytime configuration. And somewhere in the administrator's office on the 3rd floor, a man who had shoved her away from an operating room door less than 24 hours ago was sitting across from a woman who now had everything she needed, and the reckoning that was coming for him was no longer a question of whether. It was a question of scope. And scope, it turned out, was considerably larger than Emily Carter. The HR director's name was Constance Mwangi, and she had been with Pine Ridge Regional for 9 years. And in those 9 years, she had processed terminations and grievances and compliance audits, and one very uncomfortable OSHA investigation involving a malfunctioning autoclave, and she had never in those 9 years sat at a conference table at 5:40 in the morning with a stack of files that made her feel the way these files were making her feel. Emily sat across from her. Logan had stayed in the hallway. This was not his room. Mwangi spread the files without preamble. She was a direct woman. Emily had interacted with her twice before briefly, and had clocked her as someone who said what she meant and expected the same in return. "I've been doing this job for 9 years, Mwangi said. "I want you to understand that what I'm looking at right now is not a gray area. Show me." She showed her. It was worse than Priya had conveyed, which was saying something. The Sandra Okaye situation was the shape of the pattern, but the pattern itself went back further than 14 months. It went back 6 years, to within 8 months of Brooks taking the chief of emergency medicine position. The first incident was a performance improvement plan issued to a nurse named Della Hartman, who had, according to her own documented patient outcomes, been one of the stronger performers in the department. The PIP cited attitude issues and failure to follow physician direction. Hartman had resigned 4 months later. There was no counter-documentation. There was no appeal on record. There was, in Brooks's handwriting at the bottom of the closing summary, a single line: matter resolved. After Hartman, 3 others over the following 2 years, each following the same architecture: a nurse who questioned a decision, or who filed a concern, or who simply existed in Brooks's orbit in a way that apparently registered as inconvenient. An evaluation that didn't match the clinical record. A complaint, if one was filed, reviewed by Brooks himself and dismissed by Brooks himself. A resignation. After the 3, a 2-year gap in which the visible record was clean, which was itself a data point. He'd learned to be more careful, or he'd found quieter methods, or both. Then Sandra Okaye. Then the formal harassment complaint that he'd buried under his own authority and the fraudulent evaluation he'd used as the shovel. Then 11 months of Emily Carter. The board complaint he filed last night, Mwangi said, is the first time he's moved outside the hospital to apply pressure. Everything before this was internal, contained. He had to go external because the internal tools weren't available this time, Emily said. I wasn't going to resign. Mwangi looked at her. No, I don't imagine you were. What does the hospital's legal team say? They've been on the phone since 4 a.m. The assessment is that we have significant liability exposure for every one of these cases going back 6 years, particularly Okaye, where there's a documented harassment complaint that was improperly reviewed by its own subject. Mwangi paused. They're recommending immediate termination for cause. Tonight, before this is public. Is that what Ostroff is going to do? That's what Ostroff is already doing. Mwangi gathered the files into a single stack with the careful movements of someone handling something that needed to be handled carefully. He's in her office now. She called me to tell you yourself because she thought you deserved to hear it from a person, not through the hallway. Emily looked at the stack of files. 6 years, at least 5 women, probably more that hadn't left records, hadn't filed anything, had just quietly calibrated to survive inside a department run by a man who had decided early what kind of authority he had, and had used it without restraint because nothing had ever stopped him. She thought about the woman she'd been 11 months ago, arriving at Pine Ridge with a civilian resume and a bad knee and a very deliberate intention to be unremarkable. She thought about 90-day evaluations and the phrase difficulty following physician direction and how it had landed at the time, not with surprise because men like Brooks had been a feature of her experience since before the Army, but with a kind of tired recognition that the particular brand of dismissal she'd encountered in uniform had a civilian analog, and it lived here too. She thought about the fact that what had stopped him, in the end, was not a formal complaint or a regulatory process or an institutional mechanism. It was 4 military helicopters landing on a roof. That was not a comfortable thought. It sat badly. She held it anyway, because uncomfortable truths were still truths, and she had never found the habit of looking away from them to be particularly useful. Mwangi, she said. Yes. Sandra Okaye, do you have contact information? Mwangi looked at her for a moment. I can find it. Someone should call her, officially, from the hospital. She paused. And the others? Yes, Mwangi said quietly. Someone should. The sun came up over Silver Falls at 7:12 in the morning, and it came up the way October suns came up over Montana, low and cold and clean, throwing long shadows across the valley floor and lighting the mountain ranges in shades that no photograph ever quite captured correctly. Emily stood at the window of the second-floor family waiting room, which was empty at this hour, and drank her 3rd coffee of the morning and watched it happen. She heard footsteps and didn't turn around, because she recognized the particular rhythm of them. Logan stopped beside her. He's gone, he said. Brooks. Security walked him out at 6:55. Ostroff terminated for cause. His access card was deactivated before he reached the parking lot. She watched the light move on the mountains. How did he look? She asked. Logan considered this. Like a man who spent 20 years believing he was the most important person in every room he walked into, and then walked into a room where that wasn't true. She turned that over. It was accurate as far as it went. It was also insufficient, in the way that watching a structure fall was insufficient as an accounting of everything the structure had done while it was standing. But it was what it was, and it was done, and the sun was up. "I want to tell you something," Logan said. "Okay? Not about tonight, or last night, or whatever the time frame is now." He looked at the window. "About 2 years ago." She waited. She had gotten good at waiting. It was one of the skills she hadn't expected the military to give her and hadn't expected the civilian world to keep requiring. "After your discharge, when I tried to reach you and you'd moved." He paused. "I told myself you needed space, that you'd reach out when you were ready, that me looking harder would be, I don't know, presumptuous." He stopped again. "That was the easier story. The real one is that I was scared of what I'd find. Whether you were okay, whether you'd tell me you weren't okay, and I'd have to sit with that and not be able to fix it." She looked at him. He was looking at the mountains. "You were afraid to find out," she said. "Yes. So you made the decision for both of us." He absorbed that. "Yes." She looked back at the window. "I wasn't okay," she said. "For a while. I'm not going to pretend I was." She paused. "But I also wasn't unreachable. I just needed someone to do the actual work of reaching." "I know." "Logan, I know." His voice was quiet, not defensive, just carrying it. "I'm not asking you to say it's fine. I'm just telling you the true version instead of the easier one, because you deserve the true version and I should have led with it a long time ago." She held that for a moment. There were things she could have said about the 8 months of rehab, about the 2 apartments, about the 3 plants she'd kept alive as a very specific and deliberate proof that she could sustain something. About the nights that had been bad in ways she was not going to detail in a hospital waiting room at 7 in the morning. She didn't say those things, not yet, because they were real, and real things deserved better circumstances than exhaustion and aftermath. What she said was, "Okay." He turned to look at her. "That's not forgiveness or not forgiveness," she said. "That's just, okay. We have time now. We didn't before. Now we do." She looked at him. "Don't waste it the same way." He looked at her for a long moment. Something in his face settled. Not relaxed exactly, but resolved, the way a person looked when they'd said the thing they'd been carrying and the world had not, in fact, ended. "Okay," he said. They stood at the window and watched the sun finish arriving over Silver Falls. Senator Whitmore held his press availability from his hospital bed in Billings at 10 o'clock that morning. Emily watched it on the break room television with Priya and 2 other nurses and a respiratory therapist named Jerome, who had been tangentially involved in the events of the previous day and felt he had earned the right to watch. Whitmore looked better than he had any business looking after the night he'd had. He was propped up, monitors visible but not intrusive in the frame, and he spoke without notes, which she respected. He named her. He named Rains. He named Logan. He described, with the particular precision of a man who had sat in many hearings and understood the value of specific language, what had occurred aboard the aircraft and in the surgical tent on the plateau. He did not editorialize extensively. He let the events carry the weight. Then he said, "Corporal Emily Carter left the United States Army 2 years ago with a combat action badge, 2 commendation medals with valor devices, and a service record that her commanding officers have described to me as among the most distinguished in the history of the medical detachments she served with. She came to Silver Falls, Montana, and worked as a floor nurse at Pine Ridge Regional Hospital. She was told, by a supervisor, that she was just a nurse. Last night, she saved 8 lives. I want to be precise about that number. 8. While managing her own injury, while working with improvised equipment at altitude, while a storm closed in. 8. He paused. The person who told her she was just a nurse no longer works at that hospital, and the Montana Medical Board has been formally notified of a pattern of conduct spanning 6 years. That process will run its course under appropriate authority. What I can tell you today is that Corporal Carter is owed an apology from every institution that allowed that environment to exist, and she is owed recognition that is long overdue. Jerome made a sound beside Emily that was somewhere between a breath and a word. Priya put her hand briefly over Emily's hand on the table, then took it back, the way people did when they wanted to acknowledge something and didn't quite have the language for it. Emily watched the screen. She was not crying. She didn't have a clean explanation for why. It was not stoicism or suppression or the absence of feeling. It was more that what she was feeling was too large and too complicated for crying, which was a release valve designed for simpler emotions. What she was feeling was the very strange experience of being seen accurately by a large number of people at once, after a long time of being seen inaccurately by a smaller number, and the strangeness of it was going to take considerably more than a press conference to fully process. She looked at the television and she thought about Sandra Okaye, wherever she was this morning. She thought about Della Hartman. She thought about the others who didn't have names yet in her understanding of the situation. She hoped Mwangi had found the contact information. She hoped the calls had been made or were being made because there was no version of this morning that was fully right without those calls. Justice that only worked when there were military helicopters involved was not justice. It was luck with good timing. The Montana Medical Board moved faster than boards usually moved, which she attributed to the combination of Whitmore's statement, the JAG documentation, and the HR audit that Mwangi had submitted in its entirety by noon. By 2 o'clock that afternoon, Brooks's medical license was under emergency review, a status that was specifically designed for situations where continued practice represented a risk and that required board action within 30 days. An investigator from the board arrived at Pine Ridge at 3 to take statements. Emily gave hers at 3:40. It was 22 minutes long. She was specific, and she did not editorialize, and she named every evaluation she was aware of and every incident Mwangi had shown her, and she named Sandra Okaye and Della Hartman by name because they deserved to have their names in the record. When she came out of the interview room, General Decker was standing in the hallway. She stopped. He was in full uniform, which was different from the previous night, and he was not alone. There were 2 aides behind him and Garrison to his right, and the configuration had the quality of something deliberate. "Carter," he said. "General, walk with me." They walked to the end of the corridor where the windows looked out over the hospital parking lot and the town of Silver Falls beyond it and the mountains beyond that. The aides stayed at a distance that indicated they understood the instruction "walk with me" to be directional only. "The Marine Corps is submitting a formal commendation," Decker said, "for the actions of the medical team aboard the aircraft and on the plateau. Your name is on it." "Raines should be primary," she said. "It was his procedure." "Raines is on it. You're both on it. It's not a competition." He looked out this window. "There's also a request from the commandant's office. Not an order, a request." He turned to look at her. "We're establishing a joint civilian-military trauma training program. Partnership between military medical units and regional hospitals in geographically isolated areas, the kind of hospitals that are 60 miles from a trauma center and need to be able to handle what comes through the door." He paused. "They want someone to design the nursing component, the curriculum, the standards." She looked at him. "It would be a consulting role. You'd keep your nursing position if you wanted it. You'd travel, not constantly, but some. You'd work with people like Raines, like the ground team on the plateau." He held her gaze. "It would be using everything you know, not the parts you decided to put away. All of it." She was quiet for a moment. "Logan," she said, "we've spoken with him separately. He expressed interest in a trauma instruction role within the same program. That's his decision to make." Decker paused. "As is this." She looked out the window. At Silver Falls, which was small and cold and full of people who were 60 miles from a trauma center and who had, on at least one occasion, needed what she knew how to do. At the mountains, which didn't care about any of it and were beautiful anyway. She thought about what she'd told Mwangi. Someone should call them. It was such a small thing to say, such an inadequate thing. The women who had been pushed out of this department had lost jobs and income and professional standing, and a phone call from HR was not restoration, and she knew it. What she could offer, what she was maybe in a position to offer, if she took what Decker was describing and built it into something real, was the kind of training program that produced nurses who couldn't be so easily dismissed because they were documented and certified and prepared in ways that made the paper trail work for them instead of against them. Nurses who had military-grade crisis competence on their civilian records. Nurses who could not be quietly PIP'd into resignation because their performance was on record in a language that transcended whatever a department chief decided to write in an evaluation. It wasn't the solution to the problem Brooks represented. There was no single solution to a problem that old and that structural, but it was something. It was what she had. "I have one condition," she said. Decker waited. "Pine Ridge gets the program first. Full implementation. Every trauma nurse in this department goes through it, and the curriculum has to include documentation standards, how nurses record their own performance, how to build a record that exists independent of physician evaluation." Decker looked at her for a long moment. "That's 2 conditions. The second one's embedded in the first." He almost smiled. Not quite, but almost. "I'll take it to the commandant's office. Tell them it's not negotiable." "I'll tell them you said that." She turned back to the window. Silver Falls sat in its valley in the October light, ordinary and specific, and hers in the way that places became yours when you'd spent enough hard nights in them. "Yes," she said. "Yes to the role?" "Yes to the role." 2 weeks later, the Montana Medical Board revoked Ethan Brooks's medical license. The decision was not close. The board's investigator had spent 12 days reviewing 6 years of evaluations, incident reports, the Okai complaint, the Hartman PIP, and 4 additional cases identified during the audit that had not been part of the initial filing. The pattern was unambiguous and the documentation was extensive, and the board's statement, released on a Thursday morning, used the phrase systematic abuse of supervisory authority and the phrase fraudulent use of performance documentation and the phrase conduct unbecoming the medical profession, and it ran to 4 pages, which was unusual for a board statement, and the 4 pages were thorough. Brooks did not issue a public statement. His attorney issued one on his behalf that said he disagreed with the board's findings and intended to pursue all available appeal options. The appeal process, his attorney noted, could take up to 2 years. Emily read the board's statement once, on her phone, in the break room, between patients. She read it carefully, all 4 pages, and she thought about the women named in it, and the women not named in it, and the years that had passed and the things that couldn't be given back. Then she put her phone in her pocket and went back to work. That was a Tuesday. By Thursday, Mwangi had confirmed that Sandra Okai had been reached, that the hospital's legal team had initiated a settlement discussion, and that Okai had retained her own attorney. Emily did not know the details and did not ask for them. They were Okai's details, Okai's story, and the best thing Emily could do was make sure the institutional record was complete enough to support whatever Okai decided to pursue. She also, on that Thursday, received a card in her hospital mailbox, handwritten. The return address was Billings. "Ms. Carter, I looked up the call sign too, Angel 6. I understand it's a designation given to the most trusted flight trauma resource in a medical unit. I thought you should know that definition extends beyond aircraft. D. Whitmore." She kept the card. She put it in the same drawer as the 3 operational patches she'd kept from her deployments. Not displayed, not hidden, just present. Evidence of a life she'd lived that she was no longer in the process of putting away. The first training session of the Joint Civilian Military Trauma Program ran on a Friday morning 6 weeks after the night of the aircraft. 12 nurses, the conference room reconfigured with simulation equipment that the military had supplied, and that made Ostroff's eyes go wide when it arrived on 2 pallets the previous Wednesday. Logan ran the tactical medicine component. He was a good instructor. She'd known he would be, had known it from the way he communicated under pressure, from the way he'd positioned himself in the cabin of the C-130 without being asked, from the way he explained things in the surgical tent when the stakes had been as high as stakes got. He was direct, and he was specific, and he didn't talk down to the people in the room, and the 12 nurses responded to that the way people responded to being treated as capable. They rose to it. Emily ran the documentation and assessment standards component in the afternoon. She stood at the front of the conference room with the slightly odd awareness of being in a room where, 6 weeks ago, Brooks had sat across from Ostroff in the middle of the night while his career ended, and she taught the 12 nurses in front of her how to build a record that belonged to them, how to document their own clinical decisions in real time, how to create a professional paper trail that was independent of any single supervisor's opinion of them, how to make themselves, on paper, as visible as they were in practice. It was not exciting material. It was not the part of the training that would make their hearts race or their adrenaline move. But it was, she thought, the part that mattered in a different register. The part that protected the work, that made the work durable, that ensured that what you did couldn't be quietly erased by someone with a pen and a grudge and 20 years of institutional comfort behind him. Priya was in the front row. She'd signed up the first day registration opened. At the end of the afternoon session, after the 12 nurses had filed out and Emily was gathering her materials, Priya stopped at the door. "Can I ask you something?" "Sure." "Why did you come here?" "To Silver Falls. To Pine Ridge." She paused. "You could have gone anywhere. Done anything. Why here?" Emily thought about it. The real answer was complicated and involved things she'd mostly processed, and some things she was still processing, and at least one thing she'd been actively wrong about for 2 years. "I thought I needed somewhere quiet to figure out who I was," she said, "without the uniform, without the call sign." "Did you figure it out?" Emily considered the question seriously, the way it deserved to be considered. She thought about the break room and the bad coffee and the bus accident and the trauma bay she hadn't been allowed to run. She thought about the helicopter and the aircraft and Muldoon's pupils and Whitmore's oximeter and the drill and the needle and the syringe and Logan's shoulder 6 inches from hers in the dark, watching a storm move south. She thought about the fact that who she was without the uniform had turned out to be more or less the same person as who she was with it, that the quiet had taught her that the knee and the plants and the hardware store apartment had all been part of the same extended education in the same fundamental fact. "I think I came here to rest," she said. "And I think what I found out is that resting and hiding aren't the same thing. I'd been doing both and calling them the same thing." She looked at Priya. "I think I'm done hiding." Priya looked at her for a moment. Then she nodded, the kind of nod that didn't need a word attached to it. She left. Emily gathered the last of her materials. She turned off the lights in the conference room and walked out into the corridor, which was a hospital corridor in the late afternoon, full of the ordinary sounds of a place that kept running, regardless of what had happened in it. Monitors, voices, the wheels of a supply cart, someone laughing somewhere down the hall, in the way that people laughed in hospitals when they needed to. Logan was waiting near the nursing station. He had his jacket on, which meant the day was done, and he looked like a person who had done a full day's work and was ready to be somewhere that wasn't a hospital, which was a feeling she understood completely. He looked at her when she came down the hall. She looked at him. "Dinner?" he said. "Yes," she said. "Somewhere that isn't a cafeteria." "I know a place." They walked out through the ambulance bay. The October air was cold and clean and carried the particular smell of Montana at the edge of winter, pine and stone, and something that wasn't quite cold yet but was practicing. The mountains were doing their purple at dusk thing to the west. Silver Falls was making its ordinary evening sounds. Emily Carter walked across the parking lot with a slight hitch in her left leg that was permanent and manageable, and had been with her long enough that it was simply part of the way she moved through the world. And she was not hiding from anyone, and she knew what she was and what she was for, and the next thing in front of her was dinner, and after that was the program, and after that was the work, the ongoing specific daily work of doing what she could do in the place she was. That was enough. It was, she had come to understand, precisely enough. Behind her, through the hospital's glass doors, she could see the nursing station where Priya was starting the evening shift, where a new group of trauma nurses would, over the next months, learn to speak the language of crisis and to document their own worth and to walk into whatever room needed them without apology. She didn't look back. She knew what was there. She walked toward the mountains with the last light on them and did not slow down. There are women and men in every hospital, every department, every institution who carry more than their title suggests, who were told to stay in triage when they had the training to run the room, who had their records rewritten by people who found their competence inconvenient, who left quietly, not because they failed, but because the structure around them was designed to make them feel like failure. They are not gone. They are somewhere, doing the work, waiting for the environment to catch up to what they already know about themselves. The lesson is not that it takes military helicopters and a senator's press conference to vindicate someone. The lesson is that the vindication was always deserved, long before the helicopters arrived. Do not wait to be seen. Build the record. Do the work. Know what you are. The room will catch up eventually, and if it doesn't, find a better room.